headache, chills, yeah, fever, shortness of breath, runny nose, how about burning eyes, you know, mucus, you know the mucus, right? If it's white, it's right. If it's yellow, green, it's mean, you know, right? You look at those colors. So most of the time we don't see the infection, but we see the symptoms. We feel the symptoms. And when you've had those symptoms for a long time, that's when you run to your doctor, right? She got a symptom over there. I hear a symptom in the room. There's a symptom in the room, okay? But we don't know if it's an infection. So not every cough, excuse me one second, not every cough, I used to tell everybody, not every person that coughs is COVID. Just because people cough don't mean to have COVID. Stop telling people you got COVID. You know, you actually have to do a test to find out if someone actually has COVID. You know, it may look like it, but it could also look like the flu. It could look like a cold. Which one is it? Is it the cold? Is it the flu? Is it COVID? Is it my allergies? Because they all have the runny nose, sinus congestion, cough, I could be short of breath, tired, weak. They all show up the same. But I want you to be clear. Infections could be virus, the tiny one, the bacteria, the next one, and a fungus. I'm going to give you examples. So we all know about viruses now because of COVID. But the flu is also a virus. So anybody else know anything else? What else is a virus? The flu. What else? AIDS. AIDS is a virus. What else?
AIDS and cancer is a virus.
No. It can be carried.
Yes.
Herpes is a virus.
A lot of STDs.
Yeah, a lot of the STDs are viruses. All right. So when you see those things, so guess what you don't treat viruses with? Antibiotics. A lot of people call up the doctor, Doc, that's me. Give me an antibiotic. Yeah, how many of you call up your doctor and say, hey, I got a cold, give me an antibiotic? Or you walk in there, I need an antibiotic. I need something. Say that again?
I went to the doctor to see
Yes.
if I had COVID. He said no,
Right.
but he gave me antibiotics to help kill the cold.
Okay. So they were using a lot of terms with her. So let me go over her story. She said, hey, I went to my doctor. I wasn't feeling well. And the doctor tested me for COVID. And he said, no, I don't have COVID. He said, I had a cold. Now here is the misnomer. A cold. The majority of colds are viruses. You cannot kill a cold because it's a virus with an antibiotic. You can't kill it because they don't work, right? It's sort of like, you know, I guess the best example is, you know, you have roach spray and then you have the ant spray, right? Then you have termite treatment. You ever try killing termites with roach spray?
Doesn't work. It does not work.
Have you ever tried killing those ants with the roach spray?
I tried to kill a roach with the ant spray.
Did it work?
No, with this liquid bleach that we have. I didn't have any spray at the time.
Did it work?
So liquid bleach.
Yeah.
In the bottle where you spray.
Yeah.
I didn't have any roach killer, so I sprayed that on it. I thought they were
Did it work?
No, I don't think so.
Not even bleach will kill those roaches. They're going to be here till doomsday. I guarantee you roaches, yes. What?
The 91% alcohol does.
90%? 91% alcohol.
91.
Okay, so whatever you drink, pour it on. Okay, pour it on. Oh, right.
some of us call them rising.
Yes.
Some of us call them boils.
Yes.
What about that?
Okay, so what she's talking about is a boil or a rising or something that lifts up on your skin. So this is your skin, and all of a sudden this big knot shows up.
What
And
causes
it's,
that?
it comes from a bacteria that lives on your skin, usually called staph or strep. They live on your skin, and oftentimes we may cut ourselves, scratching, and then we cause whatever's living underneath our nails to penetrate our skin, and then our body responds to what you've penetrated your skin
Did you
with.
say stress?
Strep. It's a bacteria. Like yeah, like strep throat.
Yeah.
I had strep throat. They were talking about a bacteria. But with the rhizoid, which is called the boil, and in medical terms, it's also called an abscess.
Yeah.
I like the word abscess because it sounds nasty. Because it really is.
Think about
it
pus.
has a pus. Because when you squeeze it, a lot of stuff comes out of it.
Yeah.
I went to the
Yeah.
doctor last week because I had one right here.
Oh wow.
And it was, the first time it came, and it went right away. Now the next time, it got bigger.
Yes.
So I went to the doctor and he did give me some antibiotics,
So-
and it's gone.
So now it's gone. Now what's important about abscesses is sometimes what you're seeing on top is only what we call the top of the iceberg. So you have to be careful with them because underneath
They got a bottom.
they got a little bed under here that they're living in. So you pop this, but you didn't get what's underneath here.
Yeah.
And this is why sometimes your doctor may give you antibiotics, because what does antibiotics do? This is my drawing here, but I want you to visualize that this is a blood vessel. A blood vessel is a highway. The highway to all parts of your body. That highway carries blood. But it also carries anything else like medications. So then the medication goes to the bed of the infection and kills it here. And then sometimes even with antibiotics, these very, very resistant infections, they go, oh, you gonna mess with my bed? I'm gonna create a nice little wall right around this bed so you can't get in. In which case, the doctor may have to not only give you antibiotics, they have to cut it open and take the bed wall out, the capsule, what I call the capsule. You take out the capsule because it's like a balloon. You squeeze the balloon, the air comes out, but you still got a balloon.
Is that what we call lance?
Yes, they go in, they lance, but even with lancing, you have to remove the capsule to take out the balloon so it doesn't fill back up with pus. Yes.
Now I have a question. Back in the day, my father-in-law told me, take the lining of an egg.
They'll draw it out.
It works temporarily.
Can you use?
Well, in the beginning, sometimes because you can feel it coming, but it's not yet ready. What we call ready, meaning that it's not erupting, it's not releasing the pus. So one of the things I always tell people, you want to put something warm, a warm compress. My favorite is boiling an egg because I find boiled eggs hold heat longer. Because you ever warm up a towel, get some hot water, put it in the towel. By the time you put it on there 2 minutes, it's cold.
Yeah.
So you constantly heat it up, put it on, go heat it up. Boil yourself some eggs. Keep them in the shell. Get yourself a towel, a little towel, thin, and put the egg in it, and then put it on there. It'll last way longer than that hot towel. If you don't have a heating pad, yes.
The bacteria up under the skin, if there's bacteria up under the skin, could that also cause psoriasis? Surface?
Call what?
Psoriasis.
Psoriasis. So she asked a question about psoriasis on top of the skin. Psoriasis really is almost genetic. It's actually what I call think of it like dandruff, where it's flaking, your skin's flaking off. And it's really an autoimmune where your skin is overreacting to the environment and you're putting off more skin cells than you really need to be putting off. But that's not an infection. But an infection comes from a bacteria, right? Yes.
So you said that basically, for example, like let's say you scratch your skin and your nails are dirty and the bacteria gets in there, it might cause a boil or something like that. So is all the pus and all of that your body trying to kill whatever is in there?
So yes, your body, now remember, I love our bodies. Our bodies are amazing. So don't run to antibiotics first, right? Make sure your immune system is really strong. So there are things that you can do. One, you want to really, really keep your skin clean, not over clean, because then you destroy the bacteria on your skin that is there to help you. We actually have good bacteria. We live together with good bacteria on our body and in our body. And so unless you have to take antibiotics because nothing is working, don't. I'm having this talk because I don't want you running in for I'm sneezing, you got a virus, and you want antibiotics, and antibiotics only treats bacteria. Because then you get rid of your good bacteria, which is supposed to protect you, right? So your body normally, when it sees an infection, it's like keeping on guard. Your body's always on guard. They're called your white blood cells. Your white blood cells, their whole purpose is to stand guard of your body. And when they see something that shouldn't be there, the army comes out and they attack it. But if your white blood cell count is low because you have an infection, you have a cancer, because guess what? Why would your white cells go low if they're going out to kill the army? Yes.
They sacrifice themselves.
They don't sacrifice themselves. So you're carrying this infection around for 2, 3, 4 weeks. How long you had that cough? Oh, I don't know. It's been with me about a month or 2. What? Your white blood cells been going out there, shooting them down, and you're not making more in time, and they keep going out there, and like you said, sacrifice themselves and dying till your count goes down. Or you're on medications or drugs like chemo, which intentionally keeps them down and destroys them, so you become what we call vulnerable. You're open to the enemy because you've destroyed or reduced the number of white cells, right? And the smart viruses and bacteria, they've learned how to attack your white cells, your defense mechanism. So how do you keep it healthy? What you eat. The more junk you put in your body, it affects your immune system.
Your weaker soldiers.
It weakens you. So you want to have enough water to flush stuff out. You want to have enough builders for your immune system, the building blocks, your lysine, your vitamin C, your zinc, your building blocks, right? You want to rest. You want to sleep. That's when your body repairs itself. If you don't sleep well, you're going to affect your body ability to repair, right? You want to stay away from toxins and toxic people. Because believe it or not, you think I'm kidding. You ever go somewhere and after you've been around them, you're like, whew, I gotta go lie down. You done drained me.
I'm telling you.
They're affecting your immune system. If you had to go lie down after being with somebody and it wasn't fun,
Yes.
okay?
Yes.
You've done affected your immune system. They are bringing you down not only emotionally but physically.
Yes.
So stay away from toxicity, okay?
Yes.
Yes.
Is a cyst the same thing?
A cyst is a little different because cysts usually do not contain bacteria. Cysts usually contain fluid and oil. They come out, it looks cheesy, what we call cheesy. You ever open one up and it looks like
Yeah.
Why do you get one?
like melted cheese?
Yeah.
Okay, that's usually the cyst on your skin, and that comes from, again, your body trying to wall itself off. And you might play with something on your skin for a long time, and after a while you develop a little knot. But when you open it, there's no infection in it. There's no bacteria in it. It's just cheesy oil that's there.
I had a mole or cyst or something on my back. So when I went to the dermatologist, he stuck a needle in it. He said nothing was there. So he said, if it don't bother you, don't bother it.
Don't bother it.
But then it got worse. So it just made a mess on my back.
Oh, I'm so sorry to hear that.
And
So,
I went to the doctor
yes,
and she,
lanced it?
no, she didn't take nothing. She just mashed it and mashed it.
Okay, so she expressed or took out the cheesy stuff, right?
No, it wasn't cheesy.
It was infection?
It wasn't cheesy. It was just, something in it, like a piece of meat was into that.
Oh,
So anyway, back in the day, they said take some fat back.
does it work? Does the fat back work?
Yes.
Hey, if it works for you, it works for me. But like I said, don't keep something for 3-4 weeks, okay? Because if it is a virus or a bacteria, every person you come in contact with, you're sharing. And we don't want to be in the sharing game if we have a virus, a bacteria, okay? Don't want to share. Keep that to yourself, okay? Yes.
What causes pneumonia?
Same thing. It can either be a virus, like COVID. COVID caused a lot of pneumonia. And it could be a bacteria. Pneumonia is now when the infection is no longer in the upper part of your lungs. It now gets into the deeper. Remember, we talked about yesterday, last time, that your lungs go from here all the way to here. When it's still up here, where it's like, that's still up here. But when it's like, okay, now you know it's gotten lower in your lungs to the point where you have thickening in the places where you're supposed to breathe out of, junk is filling it, and you're having trouble breathing, and you literally start feeling sick. Bacteria or virus. Yes.
Sometimes you can hear people coughing, it seems like it's rat, like a,
Yeah, that's that. They've been carrying junk around. Now, mind you, if you're rattling, you're waking up, you've been smoking for 30 years. You're gonna wake up with that rattle. I gotta clean. There's no bacteria in that. Only when you have a virus or a bacteria. Sometimes fungus gets in there too, right? Anybody ever open your toes? Let's go to toes. And you open up your toes, they're supposed to be nice and clean like your fingers. But instead there's this white pasty thing there. You ever
Toe
look at
jam?
it? Toe jam. You ever see that?
Yeah.
Okay. That's because you've been keeping your feet kind of wet. Well, fungus loves moisture.
So that's why it's raw.
And then it gets wet and icky, and then it starts to penetrate your skin and break open your skin. Those are fungus. They call it athlete's foot. For instance, when you have a yeast infection, that's in the family we talk about fungus. So don't go to your doctor, I got a yeast infection, give me an antibiotic. Because that's a different animal. And in fact, antibiotics can give you yeast infections. Why? Why?
Mess up your pH.
It messes up the good bacteria. You have good bacteria that lives in the vaginal area. And then when you take the antibiotics, you could be taking it for a bronchitis or a sinus infection, but it goes through your whole body. Antibiotics go through all the bloodstreams in your body. And so the bloodstream going in the vaginal area, those good bacteria that protects down there, they get washed away, and now yeast moves in. Cottage cheese friend. Looks white and pasty. Sometimes it's a little yellow. No odor. If it has odor, if it smells like fish, we're not talking about yeast. We're talking about now bacteria called bacterial vaginosis. And the worst is when you get two. You got yeast and you got bacteria. So now you got cottage cheese and you got fish. That's not a bad combination. Cottage cheese and fish. Okay, so now you need an antibiotic and you need something for the yeast, right? Okay, of course, yes.
I can remember when I was a young woman, I was having them in my arms all the time.
Yeah.
But when I stopped using the deodorant with the aluminum in it,
Yes.
I stopped having
You stop having it. So she mentioned sometimes she got infections under her arm a lot. There's a condition called hydroadenitis where people get lots and lots of boils under their arm. And I always recommend do not use deodorant. If you tend to get infections under your arm, the first thing you want to do is stop using that pasty deodorant because it's clogging your pores and it's creating infections. And as she said, avoid the aluminum. Yes.
Can you get double pneumonia?
I'm sorry?
Can you get double pneumonia?
Double pneumonia, often people say, oh, I got double pneumonia. They're really talking about having it in both lungs. You know, oftentimes pneumonia may be in the lungs. You have two lungs, or you normally do, right? And the lung has three parts to it. One side has two, one part three. So a person may have it here and not here or here. But sometimes they'll have it there and they'll have it here. And if they have it throughout, that's really bad.
My friend had COVID and she said she had double pneumonia.
She had very sick. Was she in the hospital?
Yes.
Yeah, that's the time you go to hospital. Yes.
Let me ask you a question. How do you know if you have walking pneumonia?
You will know when first you are coughing all the time, you're weak, you're fever, chills. Number one sign that people have with pneumonia is breathing because it's affecting the lung. You're having trouble catching that breath. You know, it's hard. You're coughing. Sometimes you bring up colored mucus. Sometimes it's clear or white. Don't go too much on your colors, you know. But if it's thick and gooey with you feeling, we're talking about symptoms. Short of breath, I can't breathe. I used to be able to run up those stairs. I can't even get out of bed to go to the bathroom. Straight to the ER, get a chest x-ray immediately. So people walk around because they're hard-headed, they feel sick, they have fever, they have chills, but I'm gonna work. And they walk around spreading it, one for you, one for you, one for you. That's what people did with COVID and the flu. You know, they just said one for you, I was giving you, you know, and just be sharing. If you're gonna share something, share some Benjamins. One Benjamin for you, one Benjamin for you, Abraham for you. You know, just share some bills, but don't share infections. So to summarize, I want you to understand: if you're feeling a symptom, shortness of breath, weak, tired, bring up mucus, your head hurts, your eyes are draining, greenish stuff. You ever wake up in the morning and you can't open your eyes because it's still shut like glue in your eyes? And then when you open, you see it's all red underneath. It's very possible you have an eye infection. So how'd you
Is
get
that what they call red eye?
pink eye? So the question is, how are we getting, I'm going to summarize, how are we getting all these infections? I touched on it.
Not washing your hands.
You're not washing your hands. You know you go in the bathroom, you got some people, they go in, you know you didn't hear no water running.
Right.
And they come out, touch the doorknob. You know they didn't wash no hands.
And then you come and touch it.
Then you touch it, and then you blow, you know, or something gets in your eye and you start rubbing your eye. So you now transmitted, because again, we don't see bacteria and viruses all over. You don't see it. So you're touching things, but it's not like the doorknob lit up and you can say, whoop, I'm not going to touch that. We don't know that. So it's important, you know, before you eat, that why are you going to do it before you eat? Because you're putting your hands to your mouth. Okay? Before you put your hands in your face, wash your hands. You know, I don't believe that you should be, you know, 10 times a day washing, hand sanitize. No. It's important to do it when you're contacting food that's going in your mouth, when you're going to touch your face. Because what happens is you can also destroy your good bacteria that lives with you as a friend by killing it with tons of hand sanitizer. You wake up your hand sanitizer, you ain't touch nothing and you're using hand sanitizer like body lotion. You know, hand sanitizer is not body lotion. It's there for, yes, it dries your hands out, but it also destroys your good bacteria that's supposed to protect you. So then your hands start to crack, and then when they crack, it's time for infection to get in. So before, you know, you're going out, before you come in, wash your hands. You're going to eat, wash your hands. These are things they taught us as kids. Don't you come to that table and you wash your hands. Remember that? Okay? You know you went in a public place and you're going back to your house, wash your hands. That's a good time to use your hand sanitizer. And for goodness sake, if you're sick, stay home. Don't be sharing.
Exactly.
You know, stay home. Stay home if you're ill, you know? And if you do have to go out, we now have masks galore. Put on a mask. And most importantly, very important, stop taking antibiotics for viruses. If it's a cold, lay home, drink your orange juice. You know, if you can't drink orange juice, drink lots of water and some lemon in hot, warm water, and rest. Give your body time to rejuvenate and heal itself. Yes.
Some people scared to stay at home if they're sick because they might get fired. If you take a doctor's note, do they have to let you out of that day? I don't know the right way to say it, but you know what I mean.
People want to know if I'm sick and I don't go to work, I may lose my job. You know? One of the things you should discuss with your employer immediately when you know you're not feeling well. Not just I'm tired, I don't want to go to that job today. We're not talking about that kind of tired. You stayed out all night. You binged on your favorite show. I'm not talking about that tired. I'm talking about you know you're sick. You've been bringing up mucus, maybe having diarrhea, your runny nose, you have fever. You pick up that phone and you let your employee know that you are so sick and you know that if you come, you will infect other people in the office or wherever you are. So you will not be coming in. Some jobs require a note for every time you're out. Others require 2 or 3 days out. So you have to discuss with your employer what they require, okay? And usually, if you have a note from a physician saying this person is physically ill and should not be around other people, you know, you should not be fired unless you're a person who's just taking off left and right because you really don't like your job anyway. So I sneeze, I'm sick, you know. Okay.
So why does the doctor give you antibiotics for colds if it's
Well, that's a good question. I can only say many doctors are pressured. I hate to say it, but y'all. Well, I'm just going to find me a doctor who can give me what I need. Okay? And no matter how much you try to explain to you, ma'am, this is a virus. This is not a bacterial infection. I know what I got. Okay.
Will it help with the symptoms though?
But so most doctors, and I'm not defending them, I'm saying after a while, many doctors are breaking under the pressure and they give it anyway. But I'm here to tell you, I ain't the one. Okay? You need to show up like you say. And it's bacterial and not viral. And be tested. So then, how do we know which is it? Is it a virus or bacteria? You do a test. You know, give me some sputum, spit it up. And I take a Q-tip, I put it in there, and I send it to the lab and have them find out, you know? And for me, I've been doing this almost 30 years now. I literally, my degree is in medical technology. That was my bachelor's. I worked in the lab. I know exactly what I'm looking for. So I can look at a vaginal discharge and tell by smell, appearance, what it is. 9 out of 10 times, I will tell you that's bacterial, that's vaginal discharge. I can tell that. Even when I hear the sound of your mucus and your rattling in your lungs. And most doctors with experience can tell whether this is infection. If I look at your sinuses and you've got green mucus all throughout, you have tenderness along the sinus area, that means you're filling up with mucus, which often attracts bacteria. So most doctors have the experience to be able to determine whether it's a virus or a bacteria. But if in doubt, they will do a test. But when they tell you it's not a bacteria, believe them. Okay? Believe them. And if 7 days go by and you're still feeling sick, just go back and say, hey, it may not have been a bacteria then, but I think we need to recheck because I feel worse. Right? Like the abscess.
Right.
You know? First time they didn't give her an antibiotics, and then she came back because it didn't go away. They now apply an antibiotic. But let your body do what it do. Let it do what it do. Sleep, eat right, drink lots of fluid, bone up on your vitamin C, bone up on your zinc, build the immune system so it heals itself. And then if that don't work, go get some help. Okay? All right. You guys good? Thank